so this is the latest photo of hers where she's actually married. I think, right? This is a marriage, I'm not sure. Okay, so this is a change in the pigmentation, the melasma change from year to year. So this is actually a combination of two things. One is my Tossian cream, which you guys may have seen outside. We have done a study on it on a melanoma skin line, where we take a melanoma cell line and we subject it to the Tossian cream. So we found that the Tossian was able to inhibit the melanin formation from the melanoma skin line by 91%. So I can give you some comparator, like a hydroquinone cream. The most strongest hydroquinone cream that you can get is able to inhibit melanin by only 16%, while my Tossian, which is fully natural, is able to block it by 90%. But besides this, we also gave the doctor here a few homeopathics which target cortisol in particular and target serotonin as another thing. So a lot of women complain of melasma as they grow older. One of the causes is a very high cortisol trigger, and secondly, there is a problem in their serotonin levels. If you guys have not heard of this hormone serotonin, it's basically a hormone that helps to relax you and calm you down. So there is a specific homeopathy called sepia and coliphylum. The coliphylum helps to target the levels of progesterone, and sepia helps to target the levels of estradiol. So when sepia and coliphylum with arnica were given together along with the cream, there was a rapid improvement in the melasma. As you can see, this is only after 20 days, the pigment is clearing up. This is of another doctor's case now. So the patient came with a history of renal impairment and diabetes. They came with a history of diabetes, infection and wet gangrene. The toes had become foul smelling and they were amputated. Wound healing after 2 weeks. The feet basically were feeling cold most of the time and he was tired. Let's see the pictures. Okay. So he was on insulin 28 units twice a day with Trajenta. So again, the doctor put him on a few homeopathics like sulfur, calica, clotho. This is my medication called clotho, which I'll explain. Hydrogen, basically, it's a low-dose version of hydrogen, which helps to remove acidosis from the body. He was given this homeopathic called as carbo-wedge that helps to basically treat the gut function in patients with kidney issues. It helps to remove the excess ammonia which they are forming. He was given my Immucil, which helps to bring down the insulin resistance and diabetes combo. The major medication here which targeted his kidneys was this clotho. So this clotho is a factor that is made by your kidneys, if you've never heard of it. It basically helps your kidney work along with FGF21, which is again another factor made by your kidney, and controls your blood pressure. So as your clotho levels drop, your blood pressure will start to increase and kidney dysfunction starts to happen. Now, a lot of doctors are giving vitamin D to patients with kidney dysfunction, right? But vitamin D actually makes your kidney worse. So if you have kidney disorders and you give vitamin D, it drops your level of clotho even more, because the level of clotho is inversely proportional to the amount of vitamin D that you have. And you will notice this in your blood reports. If you give vitamin D to a renal failure patient, you'll start finding that the RBC count starts to deplete. Every single time you give the vitamin D injection or the oral vitamin D, the RBC count will deplete because the kidney is getting affected there. So we stopped any vitamin D and we just gave him clotho. So now after 10 days, just 10 days of treatment, his fasting blood sugar drops from 12 to 5.5. And you were able to slowly wear off the insulin from 28 units to 10 units. Attached are his blood reports. If you can see, the HbA1c went from 9.7 to 7.6, and his creat has started to drop with the improvement in the eGFR. So there is further improvement in the creat. Again, there is even more improvement in the creat. Just keep in mind that the urea is improving because of that carbohydrates that we get. Okay. So Dr. K he's basically a kidney expert. He's done, I think maybe hundreds of cases of even stage 4 renal failure. And it's really, really simple what we are doing. By giving Clotho, we are allowing the kidney to heal. Even in COVID patients who are having severe cough, we give Clotho. Why in COVID patients are we giving Clotho for cough? Because that Clotho is basically coating your alveoli and working as your primary antioxidant in the alveoli. So if you give vitamin D high doses to patients with COVID, you're basically causing them a lot of harm because the Clotho levels deplete in the lung. This is actually a study also that we've done, that high dose vitamin D given in patients with COVID is actually very harmful to them. Okay, so this is a patient who was 99 kg. Well, he could have actually reached 100, but he didn't. He had a history of diabetes and had difficulty in losing weight. There was no history of hypertension, no heart problems, and he did a lot of exercise, but the weight didn't drop. So he was on Trajenta and his blood sugar was still high, his FPS was 10.2. So here again, we put him on Imucil, which helps to decrease your oxidative stress. Acromegalia, Natmor to bring his cortisol down, Lux Omega to bring his postprandial glucose down. Curzinc is a medication of ours that heals the leaky gut. So we've done a lot of cases with leaky gut. How do we measure leaky gut? We basically take a blood sample of the patient and measure the amount of LPS floating in his blood. So if you have leaky gut, you're going to have some of those endotoxins made in your gut floating around in your bloodstream. That's called your LPS. We also look at the patient's HSCRP, which usually ends up going high if you have leaky gut. So there's a difference between CRP and HSCRP. If you are infected with some infection, you have a UTI or so, then doing a CRP is of great value because it's not highly sensitive. And the moment the infection goes, within 3 days, the CRP will drop. But HSCRP is different. It is used as a marker of chronic inflammation and not infection. So if you have high HSCRP, that means you are inflamed, and the most common cause of inflammation is leaky gut. But it could be other things also. It could be that you have some sort of obesity-driven inflammation. So in order to confirm, you can actually check your blood LPS levels. So Corzin was given. This is actually a drug called leptin resistance, which removes the resistance in your body to leptin. Leptin is a nasty little hormone because if it goes up too high as your body is becoming resistant to it, it makes you eat more and more and more. It also has an effect on your kidneys, causing high blood pressure. We gave him the diabetes combo and the weight loss combo. Again, this is a weight loss combo which has a certain thing known as BAM15. If you haven't heard of BAM15, it's not a band, but it's actually a factor that helps you lose weight. Sorry. Okay, so his body weight started to drop and his FPS went to like 5.3, and he basically lost 4 kgs within just 11 days with a drop in his FPS. So if you actually do these things for your obese patients, you can make them lose weight, you can bring their blood pressure down, you can bring their blood sugars down, and the most important thing is you can enable them to do intermittent fasting. You see, the problem with intermittent fasting is because your insulin levels are so high, the moment you try to fast, you start having food cravings. You're not able to fast. If you've experienced this, I don't know how many of you have tried to do intermittent fasting, you feel very, very hungry. So you're not able to do that. When you give things like acromegalia, which controls your blood sugar fluctuation, you're able to do intermittent fasting, which you would never be able to do. Also, the leptin resistance is now forcing your body to start burning fat instead of craving for more and more carbohydrate. So in patients in whom exercise is not helping them lose weight, in whom diet is not helping them to lose weight, this is excellent for them to do so. Just giving this without intermittent fasting, without a diet change may not be of any help, because the person has to put in a little bit of effort. Where is all that fat going to go? It has to be burnt off, right? This is one other one. A patient came with gastric reflux and heartburn. Occasionally she took spicy foods, causing her more pain in the stomach. She had gastritis and inflammation. She took lots of antacids, but they didn't help her. So when she came to see the doctor, he gave her this homeopathic called as bismuth met. Bismuth met is like Pepto, you've heard of Pepto, right? It's an antacid. So what happens is when you take antacids like PPIs, so if you take a PPI for too long, it's going to cause you SIBO, right? Now all that small intestinal bowel overgrowth makes a lot of gas. I'll give you an example of how much gas it produces. So just about 30 grams of a carbohydrate, if you take 30 grams of a carbohydrate when you're SIBO, it produces 10 liters of gas in a day, 10 liters. So a patient on a PPI long term is making 10 liters of gas a day and they can't push the gas out. So it goes right back up. It comes through the stomach and causes severe gastroesophageal reflux. Now, what is the PPI and the H2 antagonist doing really? They're increasing the level of gastrin. It's a hormone in the stomach called as gastrin. And gastrin is basically increasing gastric motility. But since there's SIBO that is already formed, the stomach is squeezing and pushing all the contents right back upwards. So long-term PPI is actually dangerous because they do that. When bismuth is given, it actually lowers the level of gastrin. As it lowers the level of gastrin, the stomach acids which are forming in your stomach actually increase. They go down into your colon and they treat that SIBO. And then we gave her one other homeopathic called as Thuja. This Thuja is a factor, one single symptom that the patient told the doctor that I get worse after eating spicy food. A lot of you will have this problem. The moment you eat spice, your stomach gets aggravated, you start having piles, you start having fissures. Spice is aggravating because the levels of immunoglobulin A are low in your gut. Thuja helps to correct those IgA levels. IgA is basically like a broom in your gut. It's taking all those toxins from your gut and just brooming them out of your colon. So if your IgA levels drop, those same bacteria which you should have just swept off, they start attacking your gut lining. And that is what was causing the patient the SIBO again. So this time when she goes back to Dubai for holidays, she bought me this 2-day medicine, bismuth and Thuja standby, and she has no gastric pain or spicy food intolerance after that. So this is just a few days of the bismuth and Thuja. I keep traveling every month at least for 10 to 15 days, and when I went to Paris last month, I think last month, I had a very severe acidity after eating really spicy Chinese food. In the night, I awoke with severe chest pain. I felt like I was going to die because it was really burning badly. So I tried an antacid in the night, but it didn't work. And I had some bismuth med with me. I went and took it, and that was the end of the acid reflux in just under 5 minutes. These drugs actually work very fast. You can actually give a dose to the patient, and in front of you, the patient's rash, the patient's blood pressure, hypertension will just drop right in front of you within a span of a minute or 2 minutes. So fast. This is one more case study. This was shown before, where again leptin resistance was given, immucil acromegalia, the LSD to stop the alcohol cravings, saccharin to stop sugar cravings, and of course the weight loss combo. This is before and this is after just 2 months. So there's a massive decrease in that abdominal fat, and this is because the insulin resistance has gone down. So here again the person was doing intermittent fasting, but they were not able to do it well. But after the treatment, intermittent fasting was possible, and hence they lost all that weight. This is a case of Dr. J. Okay, this is a patient with kidney failure secondary to diabetes. The patient had renal impairment. They were on metformin, dimicron, amlodipine, etc., etc. And then we started our treatment. This is high urea. It's kind of blurred, so you can't see that. But the urea in this is very high, and the creat is around 128. And after a couple of days of treatment, it dropped to 110. The EGFR, of course, would have increased after that. Even there was a drop in the uric acid levels. So how did we do this? This is again what we gave. Of course, clotho is your number one remedy. Zinc is required in order to heal the leaky gut. In fact, zinc is also very useful in our epilepsy cases. We found so many of our epilepsy cases improving after it. because most of the epilepsy cases we've seen are very food sensitive. So if you complain of any food sensitivities and in your own personal life you feel that after I eat this food or this food I start having XYZ problems, basically you are having some leaky gut. So Kurzing was given. Phosphorus is a homeopathic which helps to remove phosphate out from the kidney. So it throws all that extra phosphate out. Asafoetida and carbo-veg to decrease the urea. This will help in digestion. That asafoetida and the carbo-veg of course is dropping the urea levels. We have this medication called as renal combo which has IGF-1 in it, and insulin like growth factor 1 when directed towards the kidney can actually cause the kidneys to heal. And we give these two things one is called the uric acid combo, brings the uric acid levels down, and colchicum which is a homeopathic that works like colchicine. So the patient's renal function has improved greatly, her glycemic control is at target and her BP has normalized. So one thing about kidney dysfunction and high blood pressure. So amongst the toxins that we are exposed to that cause high blood pressure, the most common toxin is actually mercury. What mercury does in the body is really tremendous, that causes you high blood pressure. It decreases the ability of this thing called as SAMe, which is S-adenyl-methionine, to work on epinephrine. So it is not able to degrade epinephrine and norepinephrine out from your system. So epinephrine and norepinephrine keep building up in your body, causing severe vasoconstriction, shooting up your BP. Another thing that mercury does is it stops your HDL from binding to oxidized LDL and removing it out from your blood vessels. So oxy-LDL levels keep rising, and your body starts getting atherosclerosis. Mercury also causes CME to exist inside your body. So now that CME causes further inflammation and aggravates your system, and mercury depletes all neutrophilic functions. So because of that, you start getting other bacterial infections. Now, in some patients who have kidney dysfunction, when we give them or we treat them for E. coli and Klebsiella, they start improving very well. Their BP starts to drop, and when we start treating them for mercury as well, the kidney starts healing very rapidly. This is one more case. This is a heart failure patient. The EF was only 29%. The patient was on Entresto. But the PV started to crash, which means if you have heart failure, blood pressure starts to crash, it's uncompensated heart failure. The NT-proBNP in this patient continued to rise. In 2 weeks, the patient decided to lower the dose of diuretics and comply with the prescribed homeopathics which we were starting on. Now for this, we started on this homeopathic called Solidago, which acts like furosemide. It's about 80% as effective as furosemide. But it doesn't cause the problems of low sodium that furosemide will cause. We also checked the CMV and EPV and found that she had very high values. The CMV homeopathic was started and the patient rapidly improved. Again, as I said, CMV is involved in heart failure. So is mercury. So in one study, we found that patients who have ischemic heart disease or patients who have heart failure, if you check their cardiocytes, the level of mercury in the cardiocytes is 22,000 times that of a normal person. The value is actually 22,000. So we did rat experiments where we put a single mercury filling in the rat's mouth, and within 20 days that mercury was found in the uterus, causing fibroids, causing cysts. Then it went into the heart, and then it went into the brain. And for the rats who developed heart failure, that was the percentage increase of mercury in their hearts, 22,000. So as you can see this, the NT-proBNP also has kept dropping, and the patient's heart failure has hence improved. This is one more case where the treatment was basically, in the same case we gave antiviral, CMV, emetine, etc. This HGF is a factor called as hepatocyte growth factor which stops cardiac fibrosis, and hence we gave HGF. Sorry. Okay, this is a patient with eczema who was on hydrocortisone. Here, if you see, the EBV values were mildly elevated and the white blood cell count was depleted. So we stopped all the steroids. This was the original picture of the patient. And he gave this patient these homeopathics. Carcinosin because she most likely had a genetic tendency towards atopy. So in any patient where you see a genetic history of atopy, you can just use carcinosin. The antiviral was to increase the Th1 and also to treat the virus that she had. Puja was given because she was worse on spicy foods, Natmer because her low white blood cell count indicated there was low cortisol. And she was given alumina to remove aluminum toxicity. So in patients who have aluminum toxicity, they lose the ability to sweat. So a simple question, can you sweat? The patient said no. We immediately realized there was a problem with aluminum levels. All lesions completely resolved and a white blood cell count returned to normal. In COVID patients, if you see the white blood cell counts are two types. One COVID patient will have high white blood cell counts and the other will have low total WBC. So patient with low total white blood cell count requires Natmer and the patient with high requires a different remedy. So this is the image of the patient, I think. Yeah, so all lesions basically healed and all. This is case study 4. This is a case of alopecia after vaccination. If you see, there was a lot of alopecia lesions over here, and it kept increasing. So the patient was given some shots of the corticosteroid, which is standard treatment, but failed. In India now there's a big surge in alopecia areata after the vaccination, and this thing called as tofacitinib is used, but it doesn't work. If you see there's an increase in the ANA, yeah, that means of course there is an autoimmune growing. Okay, so this is before and this is after we started treatment. You can see some hair growth.